viewers, so my name is Violet Nyati and it's Health Nugget time. So as you can see, I'm wearing blue, and clever minds will remember this week we had our diabetes day. 14 November is World Diabetes Day, and the reason why we're now having this day is because diabetes is now the 7th leading cause of death among Americans. And you also find an interesting fact that 1 among 3 people living in this world are actually pre-diabetic, and the worst part is 80% of these people don't even know that they are pre-diabetic. So there is lack of knowledge. So we need to be knowing about these things. So diabetes in general is just a chronic condition whereby your body is actually failing to handle your blood glucose. So we have 3 types of diabetes. We have type 1 diabetes, which is an autoimmune disease. You can hardly control it because it's usually because of gene issues. And then we have type 2 diabetes. Now, this is the one that is mostly related to our lifestyle and the one that we need to be on the outlook for because we can actually control it more. And then type 3 diabetes, now we're talking about gestational diabetes. And gestational diabetes happens to women who are pregnant because of the hormone relationships of pregnancy to insulin. So the predisposing factors to diabetes actually include, as I alluded to earlier, the kind of lifestyle that we actually follow, the foods that we eat. And some of those foods that cause diabetes are our high processed carbohydrates and our refined sugars. So what happens is our high processed carbohydrates and our refined sugars, our sweetened drinks, when we actually take those in, those have a high glycemic index. And so the blood glucose levels will spike up, and the pancreas have to overwork during that time in order to lower those high blood levels of glucose. And afterwards, because the spike is just up and down all of a sudden, you want to keep eating more to actually to maintain your glucose levels. And for that reason, you stand a chance to be overweight and obese, and your body cells actually start to resist insulin. The other problem with your high carbohydrates and your refined sugars is that they cause the release of triglycerides in the body. And triglycerides also inhibit the production of adequate insulin in the body, in which case your cells will start to resist your insulin when it now comes in adequate amounts when you've taken in a proper meal. The other foods that we like that increase our risk of having diabetes are also our processed meats, especially our red meats. So red meats usually, because they have to preserve properly, they add nitric oxide and other harmful organic chemicals that can actually affect the work of the pancreas. So because the pancreas is affected by these chemicals, it then starts to not produce enough insulin. And then at the end of the day, they are predisposing us to type 2 diabetes. The other problem, the other predisposing factor that can actually lead to diabetes is obesity. So earlier I've talked about overeating because we are taking in foods that that have high glycemic index and that do not have a high satiety value, and hence the need to actually be eating more and more and more, and actually risking type 2 diabetes. Lack of exercise can actually be another problem because we are saying exercise actually controls your weight, it controls your glucose levels, and actually improves the receptance of insulin to body cells. And then our high fatty foods as well, that are high in cholesterol, will also affect the membrane fluidity of cells, and at the end of the day, the receptors cannot actually receive insulin properly, and then we have your peripheral insulin resistance. So we need to actually be cutting down on these foods in order to avoid type 2 diabetes, because it's mainly due to what we eat. And then the other thing that we need to do is to exercise in order to avoid it. Lack of sleep can also lead to to type 2 diabetes, because if you are up, your body, if you remain up for a long time, your body will actually start to resist there's insulin. So it is important for us to get adequate amounts of sleep so that we have our adequate amounts of insulin coming through. And the last thing that we need to avoid is stress. So stress will affect a lot of hormones in the body, and one of these affected hormones is insulin. So if you are stressed most of the time, you are predisposing yourself to type 2 diabetes because your insulin production levels actually alter. Then during gestation, because we say we have gestational diabetes that we can hardly control, it is also important during this time to exercise, and we also are on the outlook of the types of foods we eat so that we fight all kinds of diabetes together.